week's Blitz medical moment, we looked at the shoulder and how injuries can affect athletes.
Today we move down the arm as Fox 17's Tim Doty talks with Spectrum Health Medical Group about hands, fingers, and wrists.
I look at the severity of the injury. I look at the player position and sport specific and whether they can still participate if it's safe for them.
Dr. Peter Jebson of Spectrum Health Medical Group has worked with athletes at the collegiate and national levels for years. He's seen and heard it all.
There's always somebody who's seen the Discovery Channel who knows how to reduce a finger or pop it back into place. It's an okay idea on the field, but probably should see somebody afterwards and at least get some x-rays.
There are injuries specific to baseball players and golfers.
They end up with a fracture on the palm side of the hand to what's called the hamulus, which is this part of the bone here. It's actually on your hand down in here, and it can be a cause of continued pain and discomfort. It's from the impact of the ball or the impact of the bat or the club.
Hockey players often get what's called a scaphoid fracture,
which again is one of the 8 carpal bones, and the bone will break either through the waist area or through the proximal part, which compromises the blood supply and needs surgical management.
And now that we're in football season, there's a unique injury to look out for called jersey finger. It happens during a tackle.
The athlete is holding on in firm grasp. The opposing player is running away. What can happen is the tendon to the ring finger can actually rupture and pull off. And so what happens is it detaches and it can retract either down into the palm or at some length along the finger. That's actually called a jersey finger. That requires urgent operative management.
Minor injuries can turn into major problems, and healing's often the hardest part because we use our hands and fingers constantly. They're not used to being immobilized.
Look, if you have an injury to your finger, your hand, your wrist, and it's hurting after a couple of days, or it doesn't look right, or you've got some bruising or swelling, and you're really struggling with it, don't blow it off. Make sure you get to see somebody, at least get some x-rays by somebody who knows how to examine the hand and look for the various common injury patterns that we see.
Tim Doty, Fox 17 News.
Well, we've got a nice forecast on the way for the next week. Outside right